Good morning, Weber. It's always a pleasure.
I intentionally started a little late so you can listen to the song in the background. At least.
I know, it's a beautiful calypso, you know. I got your message loud and clear, Weber.
Okay, so Dr. Dwayne Thwaites, good morning again, Doc, and it's always good to have you here with us on the Eastern Caribbean Spa House to continue a discussion on health matters.
Absolutely correct.
Yeah, this morning, of course, we're going to be talking more about the COVID-19 virus and the vaccine and other areas. But Doc, first of all, you were here a week or two ago in the Federation of St. Kitts and Nevis. So, number one, you saw some, patients and so on. You can tell us how that went. A lot of folks were longing to for your visit. And secondly, you had a first-hand experience of the quarantine process, and you got a chance to interact and see how the island is doing.
Yes, I did, Weber, and I must say thanks to you. A lot of the patients that came in said that they listened to your program and they listened to me, and we were able to get some people to go out and get vaccinated. And I think that was kudos to you and to Bond Radio for making this a public campaign for public health. It is all about trying to get everybody on par and getting people healthy and help protecting themselves. So a lot of the clientele that came in were quite happy to come out, and they were able to. I mean, one of the things is during your history taking and talking to patients, being able to communicate to them appropriately. And the ones who were completely vaccinated, we were able to have a good discourse with the mask down and talk to the people and try to understand what's ailing them. So in some aspect of it, even with the vaccination, that helped. And the ones who were not vaccinated, of course, we still did social distancing and thing. And there were lots of people who have been sick and been waiting for some of this to happen. And that's what COVID does. It kind of separates you. You can't get to see your family. You can't go to see your older siblings because, you don't want to be carrying diseases to them. And it's all about public health and public awareness. And I must say thanks to you. You have done a good job in promoting some of the healthy issues to the population of St. Kitts and Nevis. And I think it's an awesome achievement to see that you were able to help some people come to get through the fears and all the negative information that is out there about the vaccines and everything. Yes, I did witness the quarantine situation, and then what is funny is that even being fully vaccinated and having to quarantine, I find that was a bit of a chore for me, especially with what's going on, because you want to be productive and you want to be out there and get back to some normalcy, and I think that the vaccine does help. And incidentally, my situation was a little bit different because while I was there, I ran into a young man who, had gone through his issues and been around, and he was in quarantine for 14 days because he did not want to be vaccinated. And so, we had a discourse about the vaccination, and he said, you know what? He said to me, Doc, I didn't know all this information. I said, because you don't listen to Webbo, you don't listen to the radio program, because all of these things are out there, and it's the fear and the fact that you hear all these negative things. And I just asked him a few specific questions, and I said, do you feel comfortable sitting here in a hotel room for 14 days because you're not vaccinated, and you could have been out there doing things, being productive, helping the community, doing things? I just think that this is a waste of time. And the information that you have about the vaccines are so erroneous, because all these years, 252, 253 years of vaccines, And we've never had one issue with the vaccine. And two, all vaccines have always been mandated. There's not been a vaccine that was made which was not mandated. People have to take them at some time. You get a nail date, it's mandated you get a tetanus vaccine before you even go before the hospital doctor even treats you. The first thing they ask if you have your tetanus. These things been mandated before. So I mean the experience for me was a little bit different. I have been back and forth. I've been traveling between Tortola and Antigua and back and forth, and I've never had to be fully quarantined in any facilities until just the other day when I came back to St. Kitts Nevis. And I mean it's a different experience, but I don't know how some people do it for 14 days or whatever, and I know a lot of people have to do that. It does take away. Again, you know, you have to stick with the protocols that are given, and that's what it is. But it does help to protect us. It does help us from spreading the disease around. And one of the big problems, especially in St. Kitts and Nevis, that has occurred over the past year or so is that even with the strict protocols, we still have breach of these protocols, and that's how the disease spreads around. So most people need to understand that's how you get disease, because one of the most regimental countries in terms of the vaccine, that's not only the vaccine, but in terms of protocols and social distance has been St. Kitts and Nevis from the beginning. From the beginning, they started early with the lockdown, and they closed down of everyone. I think it was in March that they just totally locked down everything, and have stayed so for a long period of time, and longer than most countries before they started to open up. But if you notice, what happened was just a breach in protocol. For some reason, the disease got through and it started spreading, and then it picked up later than most of the other countries in St. Kitts and Nevis. But they do have some strict protocols. We should bind by the protocols that are necessary. They're trying to help as much as possible. But the most important thing, Weber, is that it seems for some reason, again, and I say that, you know, with inverted commas, that the vaccine is doing something. When we look worldwide at the countries that are getting the vaccine, actually, the first country to reach one of the milestones of fully vaccination is Spain. 80% of their population is already fully vaccinated. And following close behind of them is Chile, who has just about 80% of their population fully vaccinated. So you see first world, third world countries, they are doing their part. And importantly, that St. Kitts and Nevis can look at what's happening in Antigua, where the government of Antigua has mandated the vaccine, and now they're almost up to maybe 60% fully vaccinated, 60% of the population vaccinated at this point in time. Maybe if we look at the true population number of 80,000, we're looking at about 66% of the Antiguan population being vaccinated. And now we're looking at getting the vaccines for the 5 to the 12-year-old vaccines coming into play. And notice the numbers has dropped down considerably. Different things are going on, and they're doing very well with what they're doing in terms of mandation for the vaccine. Again, not a big proponent, because I think each and every individual should take on the responsibility of dealing with public health, and therefore not being selfish, and be there to help protect each and every one, not only your family members, but the people that you socialize, hang out with, and go to work with. Weber.
Doc, in your interactions, and perhaps hearing varied reasons why persons are not taking the vaccine, do you hear a lot of medical complaints? Because, you know, in reading and listening across the globe, you fall on personal reasons. Some people don't tell you what they are. They would say religious reasons, some political, but somehow I don't seem to be hearing a lot of the medical reasons or excuses.
Yes, and it's an important factor, Weber, and you are absolutely correct. I'm glad that you can decipher and get out to the public some of the real reasons why people are not getting vaccine, and it's really not for medical reasons, and that's absolutely correct. Some of the people, and with my interactions with a few of the people when I came down to Nevis the other day, is that some of them had legitimately concerns about their health issues and taking the vaccine. But once you explain to those people, the few, then you find that there is no hesitancy. They just never understood that they don't understand. And now and again, and I'll reiterate this, there are very few if none, contraindication to the vaccine. Your health issues, none of those play a part. People can come in and say, oh, I've had a blood clot in the past. Should I take the vaccine? Yes, absolutely you can. It does. The chances of you developing a clot from the vaccine is very, very rare and unusual. It's not something that we see. It's very limited, and so it's important that there are the one or two disease entities that contraindicate the vaccines. We rarely see this, and those are diseases where people have autoimmune diseases, where the immune system is down. And what they tell you is that you come off your medication and you can get the vaccine. The people with arthritis who are taking steroids and all of those stuff, it is still safe to do so, to take the vaccine. And so medical reasons are very few and far apart, and as far as I'm concerned, very non-existent. One of the things that people must understand, getting the COVID disease increases your chance of getting blood clot. Okay? And for the people who already have developed blood clot, you're already on blood thinners, and so therefore the chances of getting clot is even less rare. People who have very strange disease like a protein S deficiency, which we don't even see in the Caribbean, very rarely are the ones who you concern might throw a clot with that. And it's a very rare disease, almost non-existent. You tell your doctor, so most people, for medical reasons, don't have an excuse to say so, and a lot of people are not using this. It is the contrary thing that are really upsetting the hesitance and causing the hesitancy to be so great. It is all these offshoot misinformation, which we are proven today and up to now that none of these things are happening. They're saying 5 years down the road, 6 years down the road, we're going to die, we're going to disintegrate, you're going to have immune escape. And again, my point to a lot of people out there, historically, this has never happened. It never happened before. It's not no mark of the beast, because these things been around for hundreds of years, hundreds and thousands of years. People try to associate all kind of things with the vaccine. 999, 6663. It is the date of the 6th, the 3rd, the 4th, and the 5th. And so this is what all these speculations are so erroneous and far-fetched, because none of this has happened with polio, measles, mumps, and rubella, and the vaccine has not changed in any way, form, or shape from those principles. It's basic principles, which was developed in 1797. Edward Jenner, who got his information from an African slave who told him what we did in Africa. And that principle of vaccinology has not changed to today. It's the same approach, the same thing. Nothing has changed. If for anything, Weber, it has gotten better. The solvents that we use to transfer these killed or attenuated virus or viral particles has been more efficient, more non-allergenic, don't cause no allergies, and so it's important. But you are absolutely correct. The medical reasons for not taking are very few, far apart, and most people don't complain. What we're seeing the hesitancy is from the lack of information or the misinformation that are going, the political reasons, the Bill Gates reasons for this, which are so erroneous, and it does do nothing for none of us in this part of the world. Because any one of those things that they talk about should happen, and it doesn't. And it never happened before. As I said before, I told a guy the other day, look, when we look at cricket and we say Viv Richards is one of the best cricketers in the world, and historically he has set all the records, and nothing has changed. Those records are not changed. He is still dominant when you look at the records out there. Same thing with the vaccine, my brother. The records out there has proven that they are good and that they work, and nothing has changed that since then, now, and before, and going into the future. Vaccines has been very, very helpful. So you're absolutely correct. It's only the esoteric little things that people are using to make the argument against the vaccine, which are non-existent, absolutely non-existent. And as we move forward, and this is what I have to tell people every day, as we move forward, months and days into days, the vaccine is showing that it's proven itself, that it's working. And now, look at it now, they're going to the kids. The Pfizer you can give to the kids now, and now all the schools, and again, all you got to do is look at the bigger countries. The U.S. now are noticing a big increase in the kids getting the vaccine so that they could go back to school. All of these things been mandated in the past before, and it's coming back around. It's the mandation for vaccine has been out there for our lifetime now.
Here's a related question, Doc. You've been practicing for a number of years. You have colleagues, doctors, who've been practicing and so on in reference to treating patients, medication, etc. Have you ever seen or learned from your colleagues of this level of resistance to any ailment and consequent treatment?
And that's how you're asking all the point questions. Well, actually, we have never seen anything that resistance in our lifetime, actually. I mean, and even historically, we've not seen that kind of a resistance to this one. And this is what I cannot fathom and understand. With all the technology and all the things that we have developed and done so far, people still seem to be losing confidence in the fact that medicine has advanced so completely. And you're absolutely correct. Never have we seen any resistance to the vaccines that have been developed. Even when we started looking at the HPV vaccine, and we started to vaccinate the kids for HPV because the females, the Gardasil vaccine for cervical cancer, the prevention for cervical cancer, even then we did not, and that was more recent than any time else. They started saying, look, we're going to give the kids this vaccine, the high school kids, so that they prevent them from getting cervical cancer, because the HPV virus, the human papilloma virus, will get to the skin and transform the skin both in male and female. Male will get penile cancer from certain varieties. There are certain variants. You see, I'm going back. I like these terms because people think variants is something new, or virus variating is something new. And this is what I'm saying. Misinformation is what's really killing us. So they had different variants of the HPV virus, and certain variants, 18, 33, 16, and something, will cause cervical cancer, whereas the other variants don't cause a problem. You hear what I'm just saying? Same thing again we're looking at with COVID. Some variants are more dangerous than the others. This is nothing unusual. People use that and spread misinformation. Oh, the vaccine making things variate and this and that. Bad information. So when we looked at Gardasil for the kids, some people were beginning to get resistant, but they said, look, we're vaccinating all the kids, all the females, because it prevents cervical cancer. Nobody resisted. That was one new vaccine. Again, some people use information like HIV disease. HIV disease doesn't spread by you breathing in my face. It's not one of those public health issues that really affects every individual. That doesn't really happen. You understand? And so we're looking at a situation where the misinformation again, and that's what causing the problem. Again, everybody's blaming Facebook, all these things, and why some of this. But never before, Weber, you're absolutely correct, that I can remember that we had such resistance to doing the vaccine to helping people.
Doc, in reference to the vaccine, and you had mentioned your experience and the protocols that St. Kitts Nevis had, quarantine, even if you are vaccinated. I think we got at least 1 day or 24
Yeah,
hours.
24 hours.
Now, notwithstanding, you know, different areas have their different protocols and so on and so forth. Do you think that as a show of confidence in the vaccine, that we ought to be more consistent across the islands where the quarantine is concerned? For instance, in Antigua, you may not have any quarantine days if you are fully vaccinated, etc., or in other islands, but in St. Kitts and Nevis, 24 hours, etc., etc. Now, some people argue, well, if this vaccine, you're so confident in it, and a person is fully vaccinated, why are you still quarantining?
And you know, you are absolutely right. Which textbook you read this morning, my brother? You are really asking some of the difficult questions today, and you are so right. Again, it all depends on your health institution and your experience. Now, bear in mind that Antigua hardly closed down ever. But from the time June 4th hit, they opened up their ports. June 4th last year, 4th, 5th, they opened up their ports. Their experience has been different, and they're looking again, which is so important, Webber. You look at your data, that's what you see happening in your island, and you make the decision. The government of Antigua and the Ministry of Health looked at what was going on. They opened up since June 4th. They never closed down again. They never closed down again. They kept on moving. They look at their data, they look at their numbers, and so they made a decision that, look, fully vaccinated, you're going to come right in. They made some other decisions which I thought was erroneous and not correct, but it turned out in the long run that some of these things have helped us in the future. And so they looked at what data they have and they decide. I do believe, as you said, that if you do have confidence in your vaccine, then you should do what the vaccines and what vaccinologists have been saying before, that these people are supposed to be safe. You don't need to be quarantining anyone, but you go with your numbers and you go with the decision that your data is telling you. So in Antigua, because they've been open up for so long and they looked at their numbers, they decided that, look, we are comfortable with the vaccines. Not only that, remember too, Webber, Antigua mandated vaccines, so a lot of the Antiguan population are fully vaccinated. So if you're fully vaccinated, they are demonstrating they're comfortable with their vaccine. And yes, you are absolutely right. We should be comfortable. And I have approached this in even a better way, because we are mandating, we're saying that we have, if you are fully vaccinated and you are comfortable with your vaccine, you should move on. Move on, get back to some normalcy, make sure everybody that needs, who wants to be vaccinated, and then leave it up to the rest. But again, when I say these things, people think that I'm like, oh, so what happened to the people who get the disease and again up in the hospital and going on ventilator and dying? But that is their choice. That's what they decide. So the ones who are fully vaccinated, who understand the essentiality of being vaccinated, should not be held captive or be kept back because of some people's decision not to be vaccinated. And you're appropriately right. If we are comfortable with the vaccine, then St. Kitts and Nevis should mandate the vaccines, that anyone coming in who are fully vaccinated shouldn't have to really be in no quarantine. It doesn't do much. It really doesn't do much. It doesn't do, as far as I'm concerned, Webber, and I guess this is why you asked me the question. I don't think it does anything for anybody who's fully vaccinated to be in a quarantine for 24 hours. I think it's a waste of money and a waste of time. You go, vaccinate, you go and you get out and you go about your business. And I think at some point in time, the St. Kitts and Nevis health people will come to that conclusion. But I think I don't think it does anything for the 24-hour quarantine for people who are fully vaccinated. I don't know where the science comes behind that. I can't see it make any benefit or do anything good for that. In Tortola, you go in fully vaccinated. They do a swab test, an antigen test, and once you are negative, then you're free to go, which takes about 15 to 20 minutes to get the results back, and then they tell you you're free to go. If you come in and you're fully vaccinated and you get the disease, then you go into quarantine. So a lot of the countries, Webber, make the decision on the data that they have achieved and from their experience. I don't know where this 24-hour quarantine data comes from. I don't see it helping anyone, but that's what they think is necessary, so I go with the protocol. But it doesn't hurt me. It doesn't make a big difference. I think that they can do an antigen test and let you go, or I think that it's not necessary if you're fully vaccinated and if you have confidence in your vaccine, because you're telling people to go get vaccines. If you're confident in your vaccine, all of this things is not really necessary. But you are absolutely correct.
Okay, let's do two things here. Number one, you are coming again next week, so I just wanted to mention that. Secondly, I noticed some folks are trying to call. Perhaps you have a question or comment, you can do that. We'll interrupt our discussion and accommodate you, the caller, with a question or comment you have. So first of all, Doc, you comment on your visit this upcoming, and then I'll let folks know that you can call us now. Call 469-1700. And having done that, while we're waiting for calls, if no calls coming in the meantime, Doc, we're going to discuss the booster shots or the third dose.
Absolutely correct. Yeah, Weber, I'll be in for the whole of next week. I'll be in the Federation for the all of next week, from Monday to Saturday. One of the things I would say that a lot of patients were waiting and they've missed appointments, and different things are going on with the disease entities on the Federation and stuff, which we're seeing. And a lot of people have missed out on treatments and stuff, which is really not a good thing. But again, we can always excuse it on the COVID disease. There are a lot of cases that needs to be done, which we're going to try and put into get going so that we can get back to our normal activity. I think for the prostate screening for this year, my nurses and everyone thinks that it's too close to the COVID recovery for us to do any screening with all these protocols and social distances, because we usually get this wrong. So we will not be doing any prostate screening in Nevis this January. I don't know if it's possible for us to do it in St. Kitts in June, July, which is the time we usually do it over there. But we're watching the tide. Again, Weber, as I said before, let's look at the data. We can probably do it with the fully vaccinated coming in and doing just like they did for the CPL cricket, where we just try to work amongst the vaccinated people to help them think. And I must make a point at this point in time: the people who are fully vaccinated need to appreciate what they have done, and with the assistance they have given the public and the public health in terms of being vaccinated, because everyone counts, and everyone, you're not being selfish, you are helping each and everyone so that we can get back to some normalcy. The fact that that some people are saying, oh, you can still get the disease entity, but even if you get the disease entity and you are vaccinated, you are not as infectious, you don't spread the disease like someone who is not vaccinated, who has a very higher viral load than you are. When you say high numbers, it means more disease is spread out to the public when you are not vaccinated, because your viral load is way higher compared to someone who is vaccinated, who might have picked up the disease. Your vaccine already on board, and you're taking care of the disease, so your chances of spreading disease is absolutely minimal to none that you can infect someone else with the disease itself. So that's something that we need to appreciate. That is why we're able to congregate like the CPL. They didn't find, again, this is some of the data coming out of St. Kitts, they didn't find an uptick in the disease entity after the CPL, which was so important, because that demonstrates to the public that the vaccine is doing something. Nobody got sick during the CPL who were at the cricket games. If you go back and check the data, we didn't see a rise in COVID disease during that period of time, and that's because it was fully vaccinated people who were there. Again, so we're not going to be doing the screening this January as we usually do. Hopefully next January, my nursing team, Scarborough and Jasmine, the whole crew, can get this program going, and we could go back to some semblance of normalcy. Weber.
Talking about the before we get to the booster shots and the third dose, you have persons, Doc. You just mentioned that persons who came in to see you and they were fully vaccinated, and you were able to have full conversation with masks off, etc. So it's a different level of comfort, right?
Yes, absolutely.
Now, here's maybe the difficult part, because I don't know if you heard the international story of this superstar, NFL superstar, who told the public and his teammates that he was vaccinated. Mm-hmm. He was protected, and it turned out that he wasn't. So, here's the difficult question. Somebody walks into our area, our office, for instance, and they said to me, well, I'm fully vaccinated, you don't have to worry. How do I know for sure? A person, as far as I know, is not walking around with his evidence, etc., etc. So that's a tricky one, isn't it, Doc? In terms of honesty and,
it's not even tricky. It's called hypocrisy, Weber. In their terms, this is very ridiculous. This is where I have a problem with a lot of the people who don't want to be vaccinated, yet still they want to congregate or move. And this is why I mentioned public health, because you want to not take the vaccine, but yet still you want to move around and mingle with people where you know you have that increased chance of spreading the disease to someone else. But yet still you will go as far as to lie. Actually, where there was a few incidences where people are forging the vaccine. Yeah. If you have made a conscious decision, the right of consciousness, to not get the vaccine, why do you feel you must go and then expose other persons to the disease entity? That is purely hypocrisy, Weber. Pure hypocrisy. And I know it's difficult to tell if someone tells you yes. And I'm like very fearful of that. But you would expect that if you're coming to my office or even to your office, that you would give the truth. And you see, this is how we depend on each and every individual. It's an individual dependency. This is why, people are saying, don't mandate that. You have to, at this point in time, mandate. Because each individual are not taking on that responsibility that God has given them to protect each and every individual around you. But you want to still move around and do things knowing that you can easily be a carrier of the disease and spreading it to each and every individual. We spoke a little bit about Typhoid Mary, asymptomatic carrier who was walking around killing 5-6 people, the first contact tracing where they found her, and she's like, but I am not carrying no disease. I am okay. We said, but everywhere you go, you kill 5 or 6 people. And in the long run, she ended up killing about 15 people because she was spreading the disease around. This kind of hypocrisy has to stop. What they do is unfair, and then they are responsible. You need to make them know they are responsible for if any individual dies because they spread the disease to them. I was talking to a couple the other day who are 2 persons. I don't like to use the word anti-vax, but they didn't want to be vaccinated, and they lived with the mother, 83 years old. The wife contracted the disease, came home, and now the mom is there. They don't believe in vaccines, so of course they're doing all this immune boosting, build their immune system, all the different things that they take. They say echinacea, all of this that builds the immune system for the mother. But the mother is living in the house with the wife who now contracted the disease, the husband who now gets the disease, and they have the mother in the back room, giving her all this boosting and not taking her to get the vaccine. So now guess what happens, Weber? She contracts the disease, and they continue to give her the boosting, saying she's going to recover because we're immunoboosting her. Okay? And in the long run, Weber, she ends up being on the ventilator and dying. Who do you blame for this woman's death? Huh? Who do you blame? And that's what I'm saying. The same thing with Aaron Rodgers, the quarterback. When you come and you carry disease to other people because you're not vaccinated, you need to take on that responsibility. That's your responsibility because you took the disease to these people. That height of hypocrisy has to stop. And people need to be truthful about what they're doing. And if you make a conscious decision, the right of consciousness to decide that you don't want no vaccine, you take that responsibility. Public health is important to each and everywhere. We have to consider public health above individual health, Weber, and that's important. And that's the point that we need to make with these people who have fake vaccination cards, who are telling you lies that they're vaccinated because of whatever. They need to come forth and tell the truth because you are now responsible for spreading disease entity around. The difference between an unvaccinated person and a vaccinated person, Weber, is 2 weeks. That unvaccinated person takes 2 weeks to build all that immunoglobulins and everything that's necessary to fight off the disease. The people who are vaccinated has already built those immune systems, so they're right away ready to fight. So the difference between a vaccinated and unvaccinated person is just 2 weeks, Weber. 2 weeks. And in 2 weeks, the virus can multiply trillions of times, just like the American thing, that trillions and trillions of dollars owed. You, in 2 weeks, you know how much virus can multiply. Remember, every time one virus multiply, you multiply again and again and again. So you can get trillions of these viruses within 2 weeks. That's the difference between a vaccinated person and an unvaccinated. Just tell them that. It's 2 weeks difference. You are already vaccinated, your body is ready to fight the disease. You might get a mild form of the disease, you're not going to die from it, you don't get to the hospital because you have things on board to protect you. Whereas if you're unvaccinated, it takes you 2 weeks to build those white blood cells, those T cells, those killer cells. It takes you 2 weeks. That's the big difference, Weber, between the two. So that hypocrisy is what you don't want to come around. It's difficult to decide who is vaccinated or not, but you can ask the question and hope that they tell you truthfully the truth. And some people are making fake cards. Again, Weber, and that's the same thing coming in and back quarantining for 24 hours versus just walking in. If you have one of those fake cards, you can walk in and spread disease all over. So I guess the restrictions in some places are important.
You can call if you have a question for the doc and or comment on 469-1700. Now the booster shots are the other step that we are looking at in some of the more developed countries, and they have already started. And in St. Kitts and Nevis, I don't know of Antigua as yet, but there are certain groups that have now qualified and are told that they can go ahead and get a booster shot. What's your view on it? Is it coming across the entire populations?
Well, it looks like they are going to be requesting that, and some of the people, and they're saying at 6 to 8 months that the immune protection from the vaccinations weans and comes down. There have been mixed data out there, Weber. Some institutions think it does, others don't.
Okay, Doc, just pause and let us accommodate this caller. Good evening, thank you for holding.
Good morning.
I'm sorry about that.
Anyway, good morning, this is Doc.
Yes, go ahead.
You asked the Doc a question. It was concerning the pro footballer or somebody who said to the world that he was vaccinated and turns out he was not. Then you asked the Doc a question. Well, I'm wondering, when you do get vaccinated, you get a card, and that is supposed to be evidence I remember when that was happening, I was wondering how does that correlate to the rest of the world, you know. This you have to show if you're going to travel. What is due so that if you have a problem, if one's going to have a problem finding out if somebody is vaccinated or not. If somebody is vaccinated, they're supposed to have the card. You know, they're supposed to have the card. And that leads me to another thing. I find a lot of folks around on the radio stations and stuff, and they, well, I see it as a campaign against the vaccination. And they're saying they have their rights, and they this, and they that, and the other. Okay, the local authorities are trying to convince them that vaccination is the way to go. They push back, and they push back, and they hold out, and they hold out, and they cut in all kind of style. Now, you know how the majority of the people feel about going to the U.S. The U.S. has now said, look, if you're going to get on a plane to come, make sure you're vaccinated, fully vaccinated. Otherwise, don't even think about it. And they said that in no uncertain terms. Some of the same folks, I wonder what they're thinking now. It's kind of ironic, you know. But that's why I speak, brother.
Right, caller, before you go, can I engage you?
Sure.
Yeah, when I was speaking with the doc, one of the things also I was questioning is, okay, suppose you decide that you want to come and let's talk Tuesday night, right?
Yeah.
And I said to you, well, you can come if you we can accommodate you if you're fully vaccinated.
Uh-huh.
You said, yes, I am.
Yeah.
Now, do I go on your word, or do I say, well, you have to present to me your vaccination card, the evidence? But then you may find that to be invasive.
No, I see it as the only sensible thing to do. What is the reason of giving the card? If people that is still a joke, I mean, it's not a joke. You can't go around and take people vaccinated and you can't present evidence.
Right, but people, I mean, persons would argue, wouldn't they, that they're not persons would argue, wouldn't they, that they're not going to be walking around with it.
I was going to go on a little further.
Yes, okay, sorry.
They have developed a website, a link that you could go to and download this thing on your phone. Everybody have a cell phone walking around with. So you don't have to be walking around with the card, you walk around with your cell phone as usual. So pull it up and show it to you.
Okay, so you think that we should have it ready and available for even what we will call non-unofficial reasons?
Well, whether official and unofficial, to me, is the same thing.
Okay.
It's the same thing.
All right.
Otherwise, why put it in place? Why put it in place?
Okay. All right.
Yeah.
Yes, I got you. Thank you.
Okay.
Okay, Doc.
Yeah.
You heard the discussion?
As I said, I mean, there are places where you can get a card which looks similar. You pay $300 and you get a vaccination card. A lot of people, they just had the Miami Carnival. A lot of people were doing that. You buy the card and you go. Again, in disingenuous hypocrisy, it's just not right. You made your decision. Why you want to come and impact the public health with those kind of a decision-making process? Again, Aaron Rodgers, that's just unbelievable, and it's disgusting. You need to stand up for the rights that you have made. Your right of consciousness has decided that you shouldn't do this. Stand with that. But don't come and impact the lives of each and every individual. There are fake cards out there. Again, it's important. In Antigua, you have to show your card when you go to any restaurant, anywhere you're going, you have to show your card. They have tried to make these cards foolproof. It's like a little driver's license, and there is a barcode in there which they're going to activate. So when you go to certain institution, you run your back, you put your card underneath, the barcode picks it up, and the U.S. has the barcode on top of this stuff. But again, as usual, you have fake money, you can do fake cards, and these things are all out there. These are some of the ploys that they are using out there to discredit the vaccines. Again, the fight against the vaccine goes very far and deep reaching. But why are you doing that if you know that the vaccines are not good? So something is wrong. The sense of hypocrisy is very, very real out there, people, and you got to understand. If you decided that the vaccine is horrible and you don't want to take it, why are you using a fake card? Why are you going out and saying that you are when you're not? You understand? Because you do not believe in this vaccine. Leave it alone. Go about, do what you got to do. You understand? And so it makes a big, big difference.
You know, Doc, the point that the caller made is interesting in reference to needing to be vaccinated fully to go to the U.S. And it probably shows clearly, one of the things you were pointing out earlier, where that there are different varied reasons why people are not taking the vaccine, and a lot of it seemingly are not even medical reasons. So
Absolutely.
In that particular case or cases, what you find that it wasn't any medical reasons in those instances, perhaps, but when they realize that they can't travel to the U.S., they run and go and get it. So because all the medicine remain the same thing.
Well, it's the same thing. People who the government of Antigua has mandated that you do, they go to get their vaccines now because they need to work. You need to survive. You need to eat. Again, the kids going to school. You need to go to school, Webber. You need to go to school. And this was nothing new. To go to school, you had to be fully vaccinated. And so we're just doing this thing is the same thing over and over again.
Okay, Doc, before we run out of time, I just got an indication here that somebody's online and asking us please to get to the third dose or the booster shots.
Yeah. I was prefacing in that we're given historically that some of there are lots of data out there saying that, you know, some people think that the two shots can last for at least 3 years. There are some data that have proven that the immune response and I was trying to remember the term. We spoke about the term before, where the immune response, the amount of response you get with the vaccine is higher than usual, and whether or not that immune response stays that high for a period of time. Most of the data that they're still looking at is saying that it does last for 3 years. Some people are believing that after 8 months, it wanes a little bit and wanes down, and so therefore you need to get the boost. So they're saying between 6 to 8 months you should get a booster. Most of the data that are out there right now, Weber, which is so important, I'm glad that you asked that question, is that the mixed matching of the vaccine are showing that you get a higher vaccine titer with a variant, a different vaccine. So let's suppose you get the AstraZeneca. Instead of going and getting your third shot, an AstraZeneca booster, you can go and get a Pfizer booster 6 to 8 months out. And that also builds the immune titer and carries it very high. And so you can get a Moderna with an AstraZeneca, and they're even recommending a Pfizer with a Moderna. These mixed matching of what we call heterologous vaccines are the ones that they're recommending now. So for some people, your booster shot, especially in the Caribbean, and we all use AstraZeneca, should be, and that's what they recommended, get a Pfizer 6 to 8 months out, and you will even have better immune response. But it seems like, and what they're looking at more and more, since we're just now using this vaccine, since last year, it's not even a year yet, that they think that the immune titer wanes after about 6 to 8 months. So they're recommending, especially for people who are immunocompromised, that are older, who are diabetic, hypertensive, that you get a third shot which helps you even more with your protection. And I will tell you, I have people who come to my office and say, Doc, I went away and I got 2 other shots. I had a friend, one of the doctors at my institution, where he took a Pfizer, and now he went to the U.S. and he got a Moderna. So he has 2 AstraZeneca, he has a Pfizer and a Moderna. The more, the merrier, he tells me. Again, for the people who saying you're going to get immune escape and all of these things are not true, and people are proving them wrong. This guy has, and he's doing well. He is at the forefront. This young doctor I know, he's at the forefront. He deals with all the COVID cases, every single one of them. There's how many 3,000-4,000 people who have been COVID positive in Antigua. He deals with it, but he has protected himself with many boosters of the vaccine. So it's important to understand that if you feel you have diabetes and you have underlying conditions, that you can go ahead and get the booster. It works very well, but you can also mix match the vaccine as a booster. So there is nothing contraindication, there's nothing wrong, you can do that. It seems that it increases your immune titer 4 or 5 times higher than just the regular double dose. And so it's important that we start to look towards that. Some people are doing that because they want protection. The people who are at the forefront, who are being exposed, who work in the front, where people come in and dealing with you, not people who come in and say they have a vaccine and then are vaccinated. Well, you're dealing with regular people. You should really get yourself boosted and ready for protection. Again, remember, the post-COVID sequelae, the problems that happen after COVID, are even more serious than the ones that you have when you are on the disease entity. The fatigue, the inability to breathe, the neurological diseases that occur, the memory loss, the erectile dysfunction that occurs after COVID is long-lasting and it's horrible sequelae. So if you can protect yourself from getting the disease, then you will be better off. So the boosters are very important, and we're looking more and more, and some people are even doing the heterologous vaccine, whereas they mix matching the vaccines, and some people are even taking extra doses. Webber.
And Doc, as we wrap up, we want to caution persons, though, that we're not out of the woods yet, because we are learning, at least in Colorado in the United States, they're heading for another wave, and Colorado is well vaccinated, over 80%, and the Delta variant is still moving through, and so they have to go back to some of the precautionary measures. And as you said earlier, this thing, we're not out of the woods. Yes, Doc, let me take this caller and then come back to you. Hello, good morning.
Good morning. Quick. I'm just asking for Miss Fellow, what's the time and date for Fellows?
Just call back in 10 minutes, okay?
Okay, thank you.
Okay, Doc. Yes, that was not for us, but can we go back to a word of caution for everybody that we're not out of the woods yet, nonetheless?
Yeah, absolutely not. We're not, and we're seeing some, especially with the variants who are now trying to defy some of the vaccines. But bear in mind, people, that this has happened before. Polio had 4 variants, and every time we built the vaccine, polio kept on changing, and so we had to give them what we call a tetravalent vaccine back in the day to prevent the polio spread. So this is not an unusual situation. People tend to use this as a statement to say, oh, but why do the vaccine? No, these things happen. There are variations that occur which will at some point in time, actually even measles had a variant back in the day. The most recent one was a variant, but we were able to build a proper vaccine that will help us protect us, and we will do the same thing for COVID. Yeah, we're not out the woods. Let's keep moving. Let's see if we can get to herd immunity and try and protect ourselves. And the most importantly, if we can stop the virus early, then it won't get that ability to vary and cause these more destructive variants that will destroy our body and our immune system and make us sick. So the quicker we get to herd immunity, the better it is. The virus doesn't have the ability to variate or change.
Okay, Doc, thanks much. We'll hopefully, God's willing, see you next week.
All right. Yeah. my man, and it's a pleasure, always a pleasure. Look like you took out the textbook on me today.
Thanks again, Doc. Have a nice day.
No problem. You take care. Okay, bye.